Aaron, the floor is yours.
Thank you so much. Good evening, ladies and gentlemen. My name is Darren Daraj, and I'm your 2025 president. We're so excited to have you all join us tonight for this incredible webinar on health equity and really leveraging accreditation to meet standards and align our communities, our systems, our people to continue to drive value for our patients. And so we have an incredible panel tonight, and I'm looking forward to that. Healthcare Leaders of New York is one of the largest chapters of the American College of Healthcare Executives. We're your metropolitan regional ACHE chapter, providing professional development, networking, service activities, educational development, and so much more. Your chapter is here for you from student to retirement, early careers to C-suite, and everything that we can do to support you, our healthcare leaders, our healthcare professionals, on your continued journey to add value every location, place, and person you touch. Your chapter is here to help you do that. Tonight is a qualified education event with our incredible panelists to talk about this topic and to continue to provide you the resources, the skills, and the forum and opportunity to connect. So without further ado, I'll pass it along to our moderator for tonight's event and allow the program to begin. Without further ado, thank you all and have a great program tonight.
Thank you, Darren. Good afternoon and welcome. My name is Marjorie Jean, and I am honored to moderate today's discussion on advancing health equity across our care systems. As Darren mentioned, today's session is approved for 1 hour of ACHE qualifying education credit. Just some quick housekeeping rules. If you would like to please submit your questions in the chat, my co-chair Anjana is going to be monitoring the chat and will lead our Q&A session towards the end. So today we are joined by a panel of leaders, two whose hospitals have achieved the Joint Commission as Health Care Equity certification, and one who is pursuing it. The Healthcare Equity certification recognizes hospitals that are doing the real work, using data, leadership, and intentional action to reduce disparities and improve outcomes for all. So I'd like to introduce our panelists. First, we have Dr. Taina Russo-Pierre. She is the Patient Safety Officer and Chief of Healthcare Equity at New York City Health and Hospitals, Elmhurst. She leads initiatives to eliminate harm and advance equitable care for one of the most diverse communities in the country. Under her leadership, Elmhurst achieved the Joint Commission Healthcare Equity certification. Her key initiatives include system-wide SDOH screening, expanded language access, and equity-focused performance improvement. Dr. Pierre is also an assistant professor of pediatrics at the Icahn School of Medicine at Mount Sinai and is an adolescent medicine attending caring for the underserved youth. Welcome, Dr. Pierre. Next, we have Nicole Bennett. She is the Director of Patient Safety and Healthcare Equity at New York City Health and Hospitals, Elmhurst. Nicole leads initiatives to strengthen safety culture, regulatory readiness, and health equity across the hospitals. With a multidisciplinary background in nursing, business, and organizational leadership, she integrates just culture, team steps, and high reliability organization principles into staff development and clinical operations. Nicole is committed to ensuring every patient receives safe, equitable, and high quality care. Welcome, Nicole. And finally, we are honored to have Pamela Abner. She is the Senior Vice President, Health Equity Officer, and Chief Diversity Operations Officer for the Mount Sinai Health System. Pamela is a nationally recognized leader in health equity, access, and inclusion, using data-driven strategies and education to address disparities and foster culturally aware environments. She serves as an adjunct professor at Columbia Mailman School of Public Health and sits on several national boards. Her recognitions include Becker's Black Healthcare Leaders to Know, the Diversity Women Magazine Elite 100, and Color Magazine's Power List. She is a published author and holds multiple certifications in diversity leadership and change management. Welcome, Pam. Thank you all for being here. So let's dive into our conversation today on health equity and obtaining the healthcare equity certification. But before we do that, we'd like to get to know a little bit more about your personal journey. So let's begin on the personal side of your leadership. What inspired you to step into health equity leadership? Was there a defining moment in your role or career that sparked this passion? And I'll start off with Dr. P if you can answer that question and we'll move along.
Yes, amazing. Well, my inspiration really for stepping into healthcare equity started really when I started my journey at Elmhurst Hospital. When I started at the chief patient safety officer, and then at that same time, also Joint Commission introduced their healthcare equity standard. It really became clear that equity and safety were not separate priorities. They were aligned and inseparable. So that role became a dual role as patient safety officer and chief of healthcare equity. So really that's how I became involved into healthcare equity.
Perfect. Thank you. Pam, same question?
Sure, thank you. My journey probably was not dissimilar to Dr. Pierre. I was always working in the space of addressing the needs of individuals and populations who were less served or were not receiving what they needed. And with that focus, as things evolved and the Joint Commission made that, focus on health equity, and as one goes through the accreditation process, they ask, who's the health equity officer here? It was kind of a natural fit. I've always been focused on the group that people who were left out, like what's happening to folks who don't have opportunity, regardless of what their background or color or how they, the language they speak, but who's getting left out. And using certain criterion, we were able to kind of really focus on that. So I was very happy to see when the Joint Commission kind of made this a focus and a thing, because it just solidified, a lot for all of us, really, and gave us a license to stay in this space. And it was part of we all are in terms of health organizations, and what we need to do is to take care of the needs of all. So it was just a natural fit, and I'm very happy that they had done that.
Thank you. And Nicole, same question.
So agree with you, Pam. It's definitely a natural fit. I have been doing patient safety work for quite some time here at Elmhurst, and along with quality and regulatory. And of course, in terms of patient safety, you see, so much about safety event reporting, communication breakdown, delays in care, and how that impacts the patient. And when we do RCAs and kind of drill down to the why, a lot of times it is impacting our marginalized patients the most. And so it's kind of a natural fit that healthcare equity is with patient safety. It's like patient safety is healthcare equity is patient safety. They kind of go hand in hand. So my inspiration came from witnessing these preventable harms that have been done to patients, not because of clinical ability in most cases. It's usually the human factor that's in there. And so healthcare equity allows us to like take that look at, the self and bringing it into our work to impact our patients. And just even with outside of healthcare, right, within our communities, our daily interactions, it's so broad. So that's my inspiration.
Thank you for that. And, you touched on something really key. It's, doing health equity work comes from within. You have to have a passion for it. And it sounds like each of you guys have definitely found that. And it was just a natural fit. It wasn't something that was given to you. It's just like, this is the work that I want to do. So that's really good. So how has leading this equity work shaped you both personally and professionally now that you're like, well into your careers? Everyone's been doing this for some years. Um, we'll start off with Pam.
Sure. I think that for me, it's again, kind of legitimizing what we do, if I can use that word, right? Because we know, without getting into any specifics, a lot has changed in the last year. I'll just leave it at that, right? So a lot has changed in terms of how people interact, what they think, in terms of in this space. So by having that concretized within the Joint Commission standards, it allows us to, continue to do the work that we know we need to do to take care of people, as Nicole said, has a huge impact on, quality, safety, everything. If we're not focusing on individuals based on their needs and what they need to thrive, then how are we really providing safe and quality care? So having that equity focus, health equity as key and part of the accreditation process and then the special certification, it really does. It kind of brings us all up and allows us to, kind of, if I can say, just be proud, something to hold on to, and to really bring the organization forward without focusing on some of the other negative energy that existed, was created this year. And I won't get into specifics about that. So I find it, and prior to those standards, I wasn't working as closely with the regulatory team, right? So now, Mount Sinai Health System, I'm very much entrenched with that group, working with them, and I find it to be quite pleasurable. It's really a joy to work with the teams, and I think they themselves are happy to have someone help guide them through the process and the thinking. So it's a win-win. I'm on my positive side today, so I'm going to say more things.
All
Okay.
of us are.
Thank you for that. So now that we've gotten a little bit more about your personal journey and what brought you to doing this healthcare equity work, let's talk about the organizational context. So where is your organizations individually currently with the healthcare equity certification or the journey, so to speak? We'll start off with Dr. Pierre.
Yes. I think, Pam has, highlighted a key point that the health equity certification really made us realize that, when we first started this, we used it as a roadmap to really do an evaluation of where we were and where we needed to be and where we'll end. But really, we saw it as a journey, right? That roadmap let us know that, we'll never be 100%, finished with that process. But it had us, increase the awareness of equity into the work of healthcare. Definitely when you talk about patient safety, quality, regulatory, and our HRO process had all equity embedded in it. So where we are now, it's really now hardwiring that whole concept into everything that we do. Like example, like RCAs, we have equity involved in it. Our reporting system, we have an equity embedded into it. um, our PIs now, every PIs that we do have an equity lens in it. So it's really having it becoming the language of everything that we do. So yes, it's a journey. So I can't really tell you pinpoint of where we are, because as we have to keep refining and seeing there are areas that we need to improve. But definitely it has been a journey for us.
Thank you. So everything is from an equity lens going forward,
Yes.
so which is really good. And Pam, I know you guys are in the process of obtaining the certification. Where are you guys now? At what step are you guys at now?
So I like the word journey. So the journey was for us to bring together, we're a multi-site institution. So one, and I think one of the most positive things was we recently created a system health equity committee within the regulatory structure instead of just having site committees where things were done, not together as a team. So that's one. So that was a big thing for us to just say, let's just everybody get together. Um, as part of our process for preparation, focus on data was key, right? As it is for everybody here. And so we made huge strides in creating a centralized place for everyone to look at data. And um, we have been working with teams to identify um, clinical initiatives that we had so that when they're in conversation with the Joint Commission, whenever that may be, that they can be more comfortable seeing what's going on, how others at other sites may be addressing a specific outcome or where there's a variance in care. And we just have these continual conversations and having people get together so that they're comfortable doing that. So it won't be,
Hmm.
and they can hear how their colleagues have prepared. My office and my team, we are the repository for patient data. So we provide them with tools that they can use patient data in terms of the analytics, right? And kind of look using data to discover where there might be a variance or gap in care, and then we can further, determine if it's a true disparity. But we provide them education, how to speak about it, how to feel comfortable just talking about data, because as you know, the Joint Commission will ask you, what have you done? What disparity have you found? How are you addressing it? So we're doing that anyway, and we literally have an on-site hub that we created that folks can get into and see work that's happened across somewhere in the system that their colleagues have addressed and what types of things they have done to address those those potential disparities. So I think it's built, again, we haven't applied, but when we do hit the button to apply, I think we'll be in a very good ready state because for at least the last year or so, we've been talking often, we have regular meetings and it's everyone, and we let people ask questions. So our committee has helped kind of pave the way. And we had to wait for a number of reasons as different teams were coming into Epic and we were standardizing that information and making sure that we would be in the best position for the organization. So, yeah, I think that's where we are right now. And again, I think the ongoing interaction, the education that my team in part provides to the clinical leads and teams has made them more comfortable. And I've actually seen people kind of relax and not be so nervous. And one last point is that I have to tell you at the beginning, people were very nervous. Like, oh my God, what are we supposed to do? The equity,
Right.
the equity questions. And it's
How do
like,
you
okay,
embrace this? Yeah.
yeah, like, oh, yeah, like everybody calm down. It's okay. But in all seriousness, we really did have to um, help engage folks in how to use data because they're asking very specific questions around data. Um, and many folks were not looking at data that way and with this lens. And I do like the terminology, this lens of equity. And so we've really made great strides in moving that ahead and forward.
Thank you. So you mentioned something about it being a system initiative. So to the Elmhurst folks, in terms of system, I know Elmhurst has the certification, but how does it look system-wide for the the New York City Health and Hospitals system in terms of the health certification? Nicole, do you have any input or insight on?
So we actually, Elmhurst embarked on the certification 3 years ago as a standalone hospital within the system. However, over the last year and a half, we have migrated to incorporating all the other hospitals. So at the system level, all the hospitals are involved in healthcare equity, and the goal is to move us into certification for the entire system. So we're currently, I think Pam mentioned, all the hospitals, H&H Health and Hospitals are meeting. We meet, we have a committee, we meet monthly. We share, a lot of education is done through those meetings, which a lot of what has been done during those meetings, we've also used it within our facility at Elmhurst just for education, information. And I think to Pam's point, everybody kind of was a little what is equity, right? Because it sparks so much discussion. But once we kind of broke it down and we anchored everything on the data, right? And why we're looking at the data, the equity lens, that was a key, I think that was a key piece of just education as well. Because in our performance improvement projects that we're doing, right? We're not just looking at data, but we're looking at the equity piece of the data, right? So that was a requirement that the system requested for every single project, PI project. We also have kind of jumping a little ahead, but we have a quality academy. And that within that academy, everyone is taught performance improvement, how to do a project, what to look at, and equity is one of the key pieces there. But just going back to how this is the journey, right? The journey, there's so many roads that meet, and it meets at equity, right? When I say that, I'm talking from the perspective of just
Right.
culture, being able to speak up, the freedom, the psychological safety that staff has to feel in order to address some of these equity issues, right? Another road, I call them all, they're all roads that meet equity, high reliability. We're on this journey of high reliability. How do we embed that into the culture of safety? How do we embed that into equity, right? How do we ensure that the pillars of high reliability are looked at and that we're using them to help us with this equity work that we do. So that's all part of the education. And I know we did a lot of education just leading up to the certification. And we're still, tweaking it. I'm pretty sure when we come around to the next certification and ongoing, it's going to be a constant change. But ensuring that we're pulling all these roads, all these roads are meeting at the right point to help this work.
I just,
Great. Thank you.
can I add
Go ahead,
something
Pam.
to what Nicole said? So, and I think actually, I'm almost asking Nicole a question. I know I'm not the moderator, but
Go ahead.
it's when one, at least for us, when one applies for the certification, so we're a multi-site institution as such as Nicole referenced. So my understanding is that when the Joint Commission, we would be applying for certification for the entire system, not one hospital. And so what was important, and I think Nicole, you said this as well, is that we had to have everyone in the ready state all, at the same place, although the Joint Commission wouldn't be, necessarily going to each of our hospitals. They would decide upon which they would come and visit, but we had to get everyone on the same page
Right,
and be ready across the system. So that, that was a part of a change in terms of getting ready because people were at different levels in terms of readiness.
right. So let's in terms of leadership. I know we're talking about the system, we're talking about the journey. So let's talk about leadership. How has your executive teams aligned around the shared vision for health equity? Let's start with Dr. Pierre, if you can answer that question.
Yes. I was lucky at Elmhurst that, our CEO, Helen Ortega, even before we embark in the journey of the healthcare equity certification, that we had our strategic goals and strategic plan for the year where healthcare equity was really the basis of what she wanted to focus on. So such as, making sure we had, even before the word SDOH was being done, we had a thorough system of screening our patient for SDOH, even within the system, one of the few ones that are actually doing it in the emergency department. So her strategic goals align with really what the vision of our system, and along with Laura, also Laura Avicoli, which is our CMO, really supported the work that we did. Financial wise, Helen has invested a lot in our hospital, especially when it comes to about language interpretation. So much money goes into the how much money that she allowed for interpretation. For example, we have over 120 languages that we represent for interpretation, which is a big process of access to care. To me, it's like the basis of equitable care, to be able to understand your patients and also being able to have qualified providers. We just started our system process where we are making sure that if you are communicating with someone in a language other than English, that you are qualified to speak to the patient, because we all may think that we speak the patient's language, but are we able to really give those key medical information? So having support from my CEO and my CMO, and also all the leaders, made it pretty easy for us, but also it reinforced that this was not a process of just gaining the certification. It really gave us way to evaluate our system. I think we really took it as a process to see where are we with equity, right? I think we talk about it. We look at our community need assessment. Did our process or the care that we're giving to our patient, did it match our community need assessment? So we really review that and took that and then implemented our strategic goal to make sure we are meeting the needs of the community.
Thank you for that. So I just want to just chime in a little bit when you said language is key. And, I think, both systems, H&H and Mount Sinai, we know that that is very important to making sure that you understand the healthcare that you're receiving, being able to understand what your provider is sharing with you so that way you can carry on. So that was very key. Pam, same question. What in terms of your executive leadership, how did they support you in this journey?
I think the biggest supporter and where we really embedded ourselves, my team, is with our CMO. Through that and through our CMO's office, there is a committee that's called in our institution the Quality Leadership Council. And that's where across the system, all the CMOs, CNOs, clinical leads regularly meet. And one, as a core value for Mount Sinai, we have always said equity is a core value. So it's been there. But then in conversation with the CMO and others on the team, we realized that as these leaders come forward in our biweekly meetings, we want to make sure that we're, showing how equity is presented in all their updates, their reports on quality, safety, everything that you would imagine that would be part of the organization's metrics for quality standards. And so we spent a lot of time, supported by the CMO, being able to talk to that group about equity, how they should use how they might use data. So when they're reporting out on whatever the outcomes or measures, that it's not just one number that says, this is how we've done, but no, let's be more granular and look at our data among different groups and populations or demographics characteristics. So that has been really incredible. And so, when folks present, if you're up this week to talk about, what's happening within a department or your outcomes, you have to bring that equity lens into your discussion. You have to say how you've looked at things. And so just popping back to language, as Dr. Pierre was mentioning, we found that working, and I don't know if I'm supposed to go this much into detail with your question, but we found that language has been a huge differentiator when teams start to use data to see what's happening amongst different populations. And so just as one specific example was hospital acquired pressure injuries or HAPI, we noted that language was the differentiator in terms of the outcomes, right? So often people think that when we say equity, we're only looking at race and ethnicity, but we're looking at other factors as well. And language comes up many times, quite often, as where we see differences in outcomes, right? So that's been great. And again, working with these clinical teams supported by the CMO's office, people are asking more for their reports, their dashboards to show different numbers. And so everyone I know has dashboard reports and information that's put out there for teams. And then to say, if you see something happening, you have to go deeper. Just don't,
Right.
use the data. So that's been wonderful, and we've had great cooperation and support from all of our leaders in that way.
Great, thank you. So let's transition into community partnership. So equity doesn't begin, and end with the hospitals, So when we talk about community, Nicole, if you can answer this for us, um, what leadership approaches have helped you to build trust and meaningful partnership outside of the hospital?
So Elmhurst we have a community engagement. We have a PFAC committee. That's one. We have a patient family engagement committee that meets every month. Patient safety, healthcare equity. We're involved with that committee. And hearing from the community is important, right? Our patients is important, and having them understand as well what we're doing at a hospital level within the community and within the hospital as it relates to healthcare equity, even just defining what that means for them has been helpful. We've actually done a survey for the committee just on how much they know about healthcare equity. There is kind of going off a little bit, but there's diagnostic excellence that the Leapfrog survey looks at. That is equity, right? Because we did a survey with the committee as to, you're coming for a procedure. Is it explained to you what procedure you're having? Do you know what you're coming to get as a patient? That is equity, right? If I'm doing a procedure and I don't understand it. So engaging our PFAC committee so they know what questions to ask, they know why they should be aware of certain things. We also have a community liaison. I'm at a loss for her name right now. But she works closely with the community, does a lot of outside engagement, healthcare community events, where she shares a lot of what we do here at Elmhurst. There's a library that's not too far from the hospital. There's a lot of education done there as well, regarding what we do here at Elmhurst in terms of equity. So we have a lot of, our CEO is, I want to say, Dr. Artiega, she is a community person.
Yes.
So there's a lot of engagement when it comes on to the Elmhurst community, the Queens community here at Elmhurst. If anybody knows who she is, the community is embedded within our hospital. And therefore we cannot forget equity when it comes on to that, because she is very much big on the community here at Elmhurst.
Okay, thank you.
Dr. Pierre wants to add anything with that, because I may have missed a few things.
No, I think the community is Elmhurst. Like we are Elmhurst. Elmhurst is the community. I think one
I
of
like
the
that.
key part talking about the community is the majority of people that work here, or were either born, live around the neighborhood, or has family. So there's really a strong link into input from the community, not only through our community needs assessment, but really ongoing engagement with CBOs that we work with.
Thank you. And Pam, can you speak about the community partnership on the Mount Sinai side?
Yeah, I think I'll just give an example. I agree with what both Dr. Pierre um, and Nicole said. That connection with community is key, right? So I think the more that we can do to bring the community into our decision making and have their voice heard, so that's a focus that we have now, like everyone else. And I think that, we have our community boards, we have faith-based groups with whom we meet. I personally have presented at some and spoken to them, and educating and working with community leaders, I think, is important. So we all know that they're trusted leaders within communities. And my belief is that we should be going to those folks as well, right? Going to those communities, going to those trusted leaders and finding out what they need versus, sitting back and saying, well, come here and we'll tell you what you need, right? And so and we're bringing that light and lens into a lot of decision making. And, we all learned a lot, especially after COVID, about populations, um, and how we reach people and how we may have failed in reaching groups because we didn't have those connections. So we took those lessons as lessons learned, and to think differently about how we approach communities. And I group having focus groups, making sure community members are involved when you're putting forth new programs or initiatives. I think that's very key. And that's one of the things that I am continuing to focus on and promote as part of really having an equitable approach to patient care.
Thank you. Thank you so much for that. So let's talk about, I know like we talked about each of you guys are at different points of your journey. So want to take an opportunity for you to ask each other questions in terms of, learning from each other. So to Dr. Pierre Nicole, as you move forward, what question do you have for leaders who have already completed the certification?
Um, there's not that many of them that have completed the certification. So this is just yes, we are one of the few. Um, I think, probably is looking at, I could go from my own perspective, what are the challenges that we've had, and also asking them what are the challenges that they are facing. Because as you know, I mean, as Nicole knows, one of the biggest challenge that we had is when staff heard the word equity at beginning, it was really equal to race, right? And I don't know how that in our society that became, the definition of equity. And we had to move beyond that and to really teach people that equity, I can't change somebody's race, right? But there are so many other modifiable predictors that we could work on, like language access, interpretation, access to care, insurance, right? Food insecurity. So many other things that we could, when we're looking at our data, and not so focused into looking at somebody's race and ethnicity, but other things that we could work on. So these was our challenges, and we still continue to work on that. I will ask someone, what are your challenges that you're facing moving forward?
I guess we can ask Pam if you can, we can put that question over to Pam as your,
So you want me to answer the question? Okay.
yes.
No, I agree. Totally agree with that statement. And I love in one of our faculty, I don't, Dr. Ben has always said, race is not modifiable, but these other factors are, right? So, absolutely, we know that there are differences in outcomes for certain racial groups based on their race, but there are other factors that contribute as well. So bringing that information forward and making sure that your analytics include them, I think is helpful, right? So we all know social determinants and those factors are important. So if we can kind of line up our analytics to include those factors, then we'll be able to identify other ways to enhance and improve the outcomes for those groups, versus just saying, well, it's racial, it's race, and that's why they're failing, right? Race does not cause someone to fail. It's
Exactly.
the factors around it, and that's such a misconception. But and you're absolutely right, Dr. Pierre. People hear the word equity and they think, oh, you're just talking about Black and brown people.
Right. Yep.
And it's so that's so like one of those things you want to shake out of people. But it's really about those factors and those barriers to them having opportunity, whoever it may be. And that's where we want to go. So that takes a lot of time and education. And I heard, Nicole, you said a lot of education, but and I believe Nicole said this earlier, so I think I just want to repeat it because I think it's great. It's being able to talk about things is very helpful without people being scared and worried. And I've seen the scared and worried. Oh, can I say this word? Can I say that word? Can we even talk about things? But once they know that when we say we're focusing on equity for all groups of people, all walks of lives, to make sure everyone is level set, I think that is helpful and it makes sense. And if we use the data in that way, right? And I think that's what the Joint Commission is focusing on. Let the data tell you where the problems are. But you have to have you have to have reliable data. That's number one. Because a lot of people don't have complete and reliable data. And that's an unmitigated disaster because then you're not going to be able to really analyze things if your data is not complete. And then if the data says this is where you have a problem, this is where you have a gap, or this group is not having, then you can go in and start to dissect and fix and address things. But bringing in other factors and thoughts, I think, is very important. So I don't know if I answered your question in the way you wanted me to, but
No,
that's
that
the
was
focus.
fine.
Yeah, that's the focus that we have.
Great, thank you. So, in the interest of time, I just want to just move on. And so, if you guys could give advice to healthcare leaders now and future healthcare leaders, what advice would you give emerging leaders who want to lead equity work with authenticity and impact? We'll start with you, Nicole.
I would say equity work requires trust. I kind of my feet are planted in that part of it. Trust matters. Trust is where you're going to get a lot of this work moving forward. And I think Pam kind of said some of that before, but I would say leading with humility, consistency, and allowing people to understand that equity is not necessarily about perfection, but striving to get there, right? Striving to get to the right outcome, the best outcome, and the giving the highest level of care and the best type of care for any patient, right? And that it's individualized. A lot of the education that we did for preparing the staff to even understand what equity is and how their work is impacting equity was around these different topics, right? Implicit bias, culture, language, all these things because they're doing the work, but they may not attribute it to equity.
Right.
So explaining that is so key. So, you asking a patient in their language, or you're ensuring that you're using the language services to communicate with a patient is equitable care. And that's how patients will trust you, knowing that you're doing the right thing for them, right? So I would say if you want to get into this work, it starts with the heart. The heart leads everything. Um, and you can't separate it because until you can, get that part of it right, you're gonna get everything else wrong. So it starts with the heart. Also looking at the data, as Pam mentioned before, data is so important, and looking at the data and using the data, right? We have a lot of patients being readmitted. Why are they being readmitted? What about their care is causing them to be readmitted? Is it an individual thing, or is it something that we as a hospital, we as caretakers, we as healthcare leaders can do to help ensure that they're not readmitted, and making sure that it's not because of the lack of equitable care why they're being readmitted. And then I say, as if wanting to get into this work, you have to be able to foster psychological safety. That is key. Again, it goes back to the trust, right? Psychological safety is very important. And, healthcare equity being under the patient safety umbrella, I do the nursing orientation every month where these new nurses, of course, they're excited to be new nurses or new to Elmhurst. But there's that like fear factor, right? You're like afraid. There's that fear, right? And then you're asking them to report that you made a mistake or you almost made a mistake. You had a good catch. Like I'm asking you to report. So I always say at the end of my training to them, I'm like, so I'm asking you to report, right? Because a hospital high reliability is built on reporting. The more reports you get, the more you're able to make changes, right? Through performance improvement, through policy changes. So I'm asking you to report, but would you feel comfortable reporting if you don't have trust, right? If you know that I'm going to report something, but I'm going to be, fired or whatever the extreme is in your mind. So I would say if you want to get into this work, those are just a few things. I'll keep going, but but yeah.
Dr. Pierre?
Yes. A couple of points is, of course, you have to get buy-in from leadership, but it has to be bi-directional. You also have to have frontline staff buying. Um, Data is very key. Data, but it has to be real data. It has to be data that you can rely on. And one of the key things that you really, even from the beginning of your work, is to make sure that the data you're getting the right data, having your staff be trained to be able to comfortable asking people their race, their ethnicity, their gender, orientation, their SOGI data, because that's your baseline. If you don't have good data, you're not going to be able to really do some of these stratifiable data that you're doing. Another recommendation is really working with your patient experience team to really make your equity certification, your work as really framing this is patient centered, right? I think it's every patient matters.
Absolutely.
Even though we are focusing on the equity part of it, it's really look at the patient as at the middle of it. It's really patient centered, and every patient may have some modifiable stratification that you could work on, and so your patient experience team will help you do that. So I think a combination. You're buying from your leadership, make sure your data is the right data, it's reliable, and then having your patient experience and being patient centered.
Great, thank you. And Pam, your recommendations for this line of work for emerging leaders?
Yeah, so I'm going to come at it from a different angle because everything that was said was perfect. Um, but when I think about, I think one of your questions was like, how do you get people to even focus on this? So I look at it in addition to everything that was already said, that there's a financial implication for the organization, right? So if you ran another company, making widgets or cars and you had failures, right? So if you made tires and, a certain percent of those tires didn't work, that would be a huge issue for your business, right? Or you might not stay in business. So I would question why wouldn't you, as a leader, financial in particular or other, um, why would you allow these failures to continue in your system? How can that be? Right? We know that there are inequities which have a financial impact. So, Nicole, you talked about readmission, costs more money, right? People come back unnecessary, for things that could have been taken care of, in another way or the first time around. So I don't believe that that's not necessarily intuitive. And I hope nobody here is on finance and feels that I'm kind of beating them up. But we really have to make it part of the financial, it's a business imperative. It's not, yes, of course, it's the right thing to do. And yes, of course, we have to go with our hearts and all of that. But we also have to go look at the business side of business. And you can't have these failures, mistakes, or groups that are costing us more, by using the ER instead of using, for their primary care, instead of reaching out and getting care as they need it on a timely basis and having access. So I would add in, if you're trying to really make a point, if you were kind of like selling this to executives, of course, all the other things make sense, patient-centered. We want to build trust, connect with communities, but we have to also focus on what does this mean from a financial standpoint? Because we're all suffering, in terms of cuts. We think about what's going on with Medicaid. We have to understand that and make sure that we put the right processes in place to be more fiscally responsible in terms of how we look at equity. So we can't miss that factor as well.
Absolutely. Thank you so much. So what I've gotten from this conversation is making sure that the data, Data is very important, super important to the health equity work that we do. It literally just drives the work that we do in order for us to be able to be put the patient first, right? We have to have that data. And I like what you said, Dr. Pierre, like the patient is at the center of all of this. So the data is how we identify the patients that we need to work with. So I think this was great. So now I'm going to pass it on to my co-chair, Anjana, we're going to open up for Q&A. I think there are some questions in the chat, and she is going to lead that part of the session. Anjana?
Thank you so much, Marjorie, and our panelists for such an amazing discussion. And unsurprisingly, the quality of the questions reflects the quality of the discussion that you all have had so far. So I just want to start with a question from one of our attendees, Mary, which is, what are some ways you create psychological safety for patients? I think that's a term we've heard a lot today, especially from you, Nicole, to understand that this work is really rooted in trust. So what's the best way for us to create that safety and that trust for our patients?
So I would say, the tenets of a safety culture is what I would start with. So ensuring that patients have a voice and that they know that they can, patients need to know that they can advocate for themselves. But of course, they have to be given the environment to do that. And that's where every single employee matters, right? Every single person who comes in contact with that patient matters, because if you are not, as an employee, as a staff, facing that employee, if you're not providing that safety, then patients will more than likely not want to speak up, right? So that's where psychological safety comes in for on the patient side. But I think on the hospital side, for just any staff member, they also have to feel psychologically safe in bringing an issue up. It doesn't necessarily have to be an issue. It could be something that we're currently doing that's working, right? I don't want it to sound like it's always something bad. Because speaking up is not always about speaking up for bad things. It's also speaking up for the good things. So this is working. Maybe it's working in this area. And maybe it's working in medicine. Maybe this is something we can use in surgery. Whatever that we can actually bring everything together, bring it back, everyone can use what's working, right? And that requires the ability to have dialogue, collaboration. So psychological safety, I'm very passionate about that. As you could tell, doing this patient safety work for so long, when you think about also high reliability, understanding that you want to be preoccupied with the failures, right? Why is this not working? It's not that you're focused on the negative, but why is it not working? What can we do to ensure that we're doing better, right? One of the tenets of high reliability, sensitivity to operations, right? What can we focus? How can the frontline focus on this? What can the frontline do to help? How can we empower the frontline to speak up, to be a part of whatever the resolution is, the outcome changes? So I think psychological safety has to be across the board, not just internally for staff, but also for the patients. But I think it starts with us. And if we can provide that safety net for our patients where they can speak up, they can ask questions. And it starts with understanding who you're taking care of. So that's why equity is important, because if you understand who you're taking care of, then you will be able to open that door for their safety. If they don't feel that you know who they are and you see them for who they are, then they're not going to be safe in speaking up.
Thank you for that. I really appreciated how you tied equity into the overall overarching question of psychological safety. So thanks for incorporating both those large concepts in such a seamless way. We have time for about one more question, and I wanted to bring up a question that our attendee Cindy had asked in the chat, which is, what do you find the most effective way is to introduce the equity discussion within an organization that may not have always been thinking about equity in healthcare? So maybe this isn't related to the certification in particular, but what is your advice to people who care about health equity work, who may be working within an organization that is just starting to prioritize it?
I could start if that's okay with you, Pam. I think it's looking at your data. I think if you have looking at all your hospital acquired conditions, especially your HAI, your pressure injuries, your errors, and then start stratifying it by some type of data. And if you could show the data to them, then you're going to have a buy-in because the data will be able, no matter how much you talk about equity, if you don't have the data to back it up, and we do have the data. So use your data to show that yes, there is some outcome that definitely that the population that are marginalized that have poor outcome that you'll be able to get buy-in.
Thank you for that, Dr. Pierre. And I think it's a reminder that everything leads back to the data. Without the data, we can't tell an effective story and we can't start these critical conversations at our organizations. Maxine just put one last question in the chat, which I think is a good one. So good food for thought for the group, which is what leadership behaviors have been most effective in driving equity related culture change?
So I don't mind answering that one. And I just have to say hi to Maxine too. Um, a personal hello to Maxine. So I would say that it's really about self-reflection and self-awareness. So understanding who you are and what position you hold in a societal context and what perspectives you have about things and really understanding the perspectives of others. So I've had many, many conversations over the years, one-on-one with very senior leaders who have never thought about groups that might be marginalized or people who might not have things that they have. And I was astounded by it. And they weren't malicious people, they weren't horrible people. It's just certain people sit in a certain space in society and others sit in another space. Generally, the leaders in our institutions are going to come from a space where they may not have had interactions with certain individuals that are real, right? Understanding, other than what they might read or see somewhere, but really understanding what someone else is going through. So I think that, like, before anyone even embarks on this kind of work, that it's important to spend time understanding, what happens in communities, socioeconomically disadvantaged groups. What is life like for individuals who are from groups that are different? Some leaders may have had their own path where they may have come from different backgrounds and have experienced things. But I think understanding that we don't know everybody's story, that we have to listen to everybody's story to really do this work. So taking the time to listen to others, no matter what you think when you see them or when you first talk to them, that's an important lesson. And it's an interesting one because we're always making decisions like this and we think we know things because we have degrees after our names and we've done stuff. But really, like, how do you relate to people and communities? When have you spent time with different groups and different people? And just ask yourself those questions. I think that self-reflection and cultural awareness are things that we have to get our leaders into before you kind of toss them out into this work and expect them to miraculously know how to do it. And the data stuff, of course, of course, of course, is important, 100%. But there's that what you exude when you walk down the hall or see someone or respond to someone or encourage your teams. You've really got to do a lot of work. I know that in doing this, I had to do a lot of work myself too, right? And not assuming that just because someone is Black or Latino or Asian that they can better do it, they're better equipped than anyone else. Yes, they might have certain experiences, but we all have to do that work. I think every single person has to do that work to understand. So that's what I think. And I think if I had a magic wand, I would say anyone who's going to be a hospital leader, and I teach this to my students, um, I make them work on address or learn about perspectives and their perceptions and mitigating bias and understanding. So just getting in your head, right? What's it like to be in an industry where you're dealing with people all the time? So that's my thought on that.
Thank you so much for that, Pam. And it's a really important reminder and full circle moment that this work really starts from within. You need to have the passion and the drive, but you also need to make sure that hospital leaders charged with this work have the tools to succeed. So thank you so much for sharing that. That now concludes our Q&A portion. So thanks again to our panelists for your insightful answers and to Marjorie for your insightful moderation. I'm going to go ahead and pass it on to our President-elect Halim to close us out and remind us of some upcoming events in the new year. Halim?
Thank you, Anjana. My video is disabled. I'm trying to show myself. My video is disabled at the current moment.
Okay, we see your picture.
Thank you.
You are.
Are the slides up?
Yeah, pulling them up now, but you can go ahead and start.
So I wanted to thank everybody for taking the time out of their day to come help the organization and provide their insights and their wisdom on tonight's panel. We really appreciate it, and we are very thankful for our team for putting this event together for our members. This was a very informative and helpful event for everybody in attendance today. So thank you once again. Next slide, please. Please pardon my voice. It's something I've been struggling with all day. So my name is Halim. I'm the president-elect. If we can go to the next slide, talk about a few upcoming events that we have coming up for next year. But what we'd also like to do is to thank our sponsors who continue to show their support for the advancement of healthcare leadership and what they're doing for the organization by helping us provide the resources to provide and conduct events like this for our membership. So a thank you to all of our sponsors. Next slide, please. Again, we are always looking to have sponsors come on to help support our initiatives and our mission and vision of the organization. If there are any organizations that are represented here tonight, feel free to reach out to sponsors@hlny.org, and we'll get you connected to help sure we can have you become part of our sponsorship. Next slide, please. Well, right now we're starting to plan our events for next year. January 15th, we have a collaborative social mixer to usher in the new year with HIFMA, with HFMA. It's going to be held at One Bryant Park at the Bank of America Tower in New York. January 21st, we're going to have our first virtual event of the year, AI Insights from Selection through Implementation. This event is approved for 1.5 hours of virtual interactive credits from ACHE. Registration is now open on the website. And February 3rd, we have a save the date. This will be our first in-person event of the year held at the Tiller Center. And we plan on carrying on the legacy of commemorating and bringing awareness for National Cancer Prevention Month with leading by example, shaping a healthier future through prevention, access, and awareness at the Tiller Center once again. We are working on securing credits, in-person credits for this event as well. We will update the website once we receive that approval from ACHE. Next slide, please. Be sure to stay in the know about all of the events that are coming down the pipeline. Subscribe to our events calendar on our website at hlny.org, so that way you are notified of all the upcoming events. And keep a look on your inbox. Check your junk or your spam folder as well for our emails that come, and mark us as a safe sender, so that way you're aware of everything that's coming out of the pipeline that we're offering to the members. Next slide, please. The Foundation for the Healthcare Leaders of New York continues to provide scholarships that help develop tomorrow's leaders. We continue to help support the foundation and continue to encourage people to make charitable donations. All donations are tax deductible under the fullest extent of the law because they are a 501c3 organization, and they continue to develop scholarship opportunities and funding to help make sure that people are connected to organizations such as HLNY. Next slide, please. Thank you for joining us tonight once again. Be sure to follow us on all of our social media platforms, on LinkedIn, on YouTube. We just had our Instagram page go up this year. Again, thank you to our panelists and to our moderator for a wonderful event. Wishing everybody a happy holiday season. Take care and be safe. Good night, everybody.
Thank you. Good night, everyone.
Thank you so much. Good night.